Well, hello there and welcome. My name is Kylie Patchett and I'm your host, and welcome to the Wild and Finally Fucking Free podcast. This show is all about sharing the real and raw stories from women who have undergone midlife metamorphosis, taken a leap of faith, or broken the ties that bind them in patterns of staying stuck, small, and like their needs don't matter. You see, I believe that the years leading up to and during menopause are a rite of passage, a deep invitation after so many years of giving our time, attention, and energy to others to carve out the same time, energy, and attention in ourselves, in our health, our love, our connection, our vitality, our purpose, our real needs and deep desires. You know, those ones lying dormant underneath all the duty, responsibility, pushing, striving, and achieving of our 20s and 30s? You see, at this stage in our lives, we find ourselves shifting identity potentially, no longer caring as much what other people think, and left wondering why on earth we have not given ourselves permission to do life in the way we truly want to. In this show, I speak to the women brave enough to truth talk their own midlife shedding skin stories, and the healers and helpers who help them transition through these crossroads of change. This is the midlife magic you didn't even know you needed, and I am so freaking glad you found us. Let's dive in. Hello, everybody. Welcome to another edition of Wild and Finally Fucking Free. Today, I have an absolute treat. It is Dr. Ginni Mansberg. Hello, Ginni. How are you?
I am so good. I love the title of this podcast so much because I have the worst potty mouth in the history of the universe.
Yay!
It was just a matter of time till an F-bomb dropped and you beat me to it. So I just feel like we're in great company now.
You're welcome. I love it. We started like riffing before we even started recording, and I was like, hang on a minute, we just need to press record, because what we were just talking about, both of us were getting so fired up, and I was like, okay, settle down, press record, we'll start again. Yeah. Okay, so for people who don't know you, usually I do not love doing the formal bio because I feel like it boxes people in, but I do want to read off a few things that are the facts about Dr. Ginni to inform our listeners, if they don't already know you, which I have no idea how they couldn't if they're in Australia at least, that you are so well able to give your opinion, evidence-based, for many, 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 many years of specialty in menopause. So Dr. Ginni is a mum to three, right? 2 sons and a daughter?
Correct. And then I got another 3 for a wedding present.
So exciting.
There are 6 altogether.
Brady bunch. You have 2 doggies, Fred and, is it Fred and Ginger?
Fred and Ginger.
Yeah.
If someone comes to the door, I'll have to press mute.
Yes. Well, I have Frankie and Squishy, who is a Shar-Pei, and they also, I'm a home by myself. So we could both have dogs barking. You're a GP of almost 30 years and author of, is it 5 books or 6 now with Save Your Brain?
I think it is, there are 6 altogether.
Okay. Too many to count. My absolute obsession at the moment is one of your books, which is The M Word, How to Thrive in Menopause. I just showed you my very well dog-eared copy here. And she is a TV celebrity doctor who's appeared on and regularly appeared on Sunrise, Medicine or Myth, Embarrassing Bodies Down Under. And in your spare time, you happen to have co-founded 2 companies, one with your beautiful husband, Daniel, which is ESK, Evidence Skincare, which I really want to get to right at the end of this chat, and co-founder of Don't Sweat It, which is a company that offers comprehensive strategies to help midlife women stay engaged in the workplace. And that is one of the things that we were getting fired up about. And you're also a strategy and comms consultant, just between the hours of 2 and 3 in the morning.
Yep. And I've got 2 podcasts myself as well. So... yeah.
Okay. All right. So she's good at juggling. So where I wanted to open things up is, you just said to me before we started recording, you may have been one of the mass walkout of GPs had it not been for menopause becoming this specialty, passion, etc. of yours. Can you tell us why?
So I guess, I'm not going to sit here and bitch up a storm like most GPs do. I belong to a few Facebook groups with GPs, and let's just say we're not a very happy group.
Yes.
It can feel like we're much unloved by the world, and particularly by the government, who says Medicare and you know what, just go make your own way in life. So, I don't need, I'll drive a Mazda. I'm like not particularly fussed about things. I don't care about jewelry, I don't care about clothes, but
yes.
I want to be able to pay the power bills, and so that's not really that compatible with being a GP. But then on top of that, I think there's just this great feeling that there's a lot of input required for not a lot of love and appreciation.
Yeah, yeah.
But then I sort of came to menopause through a really strange route. And it was just this area where you are doing what I always wanted to do in being a doctor, which is really helping people. Like, we're talking really, really, really helping, and being able to watch somebody come into you an absolute complete mess, and then get them back 6 weeks later and they're a different person. And it's just one of the most satisfying, exciting, beautiful things that you can do to help women who are my peers. These are all women my age, besides the 1% of women who have what we call primary ovarian insufficiency. So that's women in their 20s, 30s, who go into menopause and don't really get what's going on, and that's not a great situation for them. 1% of Aussie women, we all know them. They often just don't realise when they're not having periods that, no, you're not just stressed, there's something else happening. And so besides them, they're all my girls. They're women exactly like me, kids the same age, job experiences the same age, parent issues the same age, partner issues the same, and just being able to help is like fills my cup so much. I can't tell you.
So good. It's so good. I am super, super blessed to have found, I live in a little country town in Queensland, and I have found this, and I just happened across her, a GP who I reckon, Dr. Shirley, I call her. Dr. Shirley, I reckon would be maybe late 50s, but she is exactly the same as what you, like, she just really wants to help. And I went to her in a period where I was like, I am losing my shit. I am going to either kill someone or fall into the biggest, deepest hole of depression that I've ever experienced. I don't know what's going on. I had just read a book that was by a naturopath about sort of balancing hormones. And then my brain was starting to go, And she sat with me and really, really took I've got goosebumps. Like, this is the gift that you're giving your patients, because I literally was like, I can't. I just can't. There was no other words in that sentence. I just can't. Is that what you're finding too when people are coming to you when they're really, really struggling with the perimenopause symptoms?
Yeah. So I think peri, as you correctly identify, is hormone hell. It is the worst time for women. And often once you're a couple of years past menopause, actually things settle down. And look, the big thing then is hot flushes and aches and pains. There's a few gut issues, but on the whole, the mental health stuff seems to sort of even itself out. Your sleep is often getting a bit better, but it's really peri that's just makes people feel like they're going insane. And we know it's the biggest risk time for both depression and anxiety, and it has some very specific characteristics. The rage that you are describing, the rage is just huge. Getting irritated by everybody, people you love, but people are actually going out there, breaking up with their best friends, having getting divorced, because everybody pisses you off. It's that kind of thing that's happening. And the research that is coming out is that you don't put all anxiety and depression in a single bucket and throw antidepressants at it. It doesn't work. And we have to acknowledge and nod to the role that hormones play in the female brain, in particular when there are big hormone swings and what's going on there, and treat it differently. So, I think the fact that you found an incredible GP is so lucky, but I feel like you found that needle in the proverbial haystack, because my patients come to me generally having hit a number of brick walls, or going to a naturopath and being prescribed a series of incredibly expensive supplements. Now, we know that for hot flushes alone, in studies, the placebo effect is around 75%, which is higher than a lot of other things. The problem with the placebo effect is that it does tend to be a little bit short-lived. So it might give you a temporary bump in, I got rid of my hot flushes. And what I normally hear is, and then it stopped working, which is just what happens when the placebo effect stops working. It doesn't last forever. Plus, it doesn't address the actual hormonal issues that you have going on, right? So it doesn't, and that has implications beyond what you feel. long-term menopause has effects on your cardiovascular system, on your brain, on your bones, on your muscle strength, on your cholesterol levels, on your blood pressure. We can't ignore those things, and no placebo effect can restore bone health. You might feel that you're getting less hot flushes, and all power to you if those have stopped. But my concern is the exploitation of women with the extreme amounts of money that they are paying, and the fact that they're not getting a holistic solution to their symptoms, and the fact that we're completely ignoring things that are not in your consciousness. Like your brain health and your bone health. So yes,
exactly. That was one of the things that I shouldn't keep on saying this because my science degree is about 30 years old. So I don't think I probably could just chuck it out. But what I loved about in your book was you have all these separate chapters about all the main sort of symptoms, like sleep. Why am I losing my mind? Why is my vagina feeling like an alien territory? Like, I just love the fact that your writing is quite, it's lighthearted about some serious bloody stuff. But you are also including the evidence behind, like, you can try all of these, go and have black cohosh or kosh, whatever you want to try. But here's the evidence, and to continue to actually bring people back to the fact that, yes, there is a lot of things on the market, and I feel like we're just entering this big monetization of menopause. Here's something else we can sell stuff to women for, and that disturbs me majorly. When someone comes to you, actually, would you mind sharing your own experience of what were the main things that you experienced going through perimenopause that really, like, the life-altering end of, or not altering, but changing end of things?
Hey gorgeous, we interrupt this gold for a delicious invitation. If your whole body has been whispering more lately, more voice, more truth, more satisfaction, more clients of the soulmate variety, more cash, more you, then this invitation is for you. Potent, my sister mind is officially open. This is my high touch, holy fuck, I'm ready sister mind for rebels in good girl clothing who are done outsourcing their power and diluting their magic to fit into someone else's business formula. If you have been craving a space where your strategy, your voice, and your energy all get to be offered, honored, refined, and amplified, this is it. Inside of Potent, you'll get my eyes on your business every single week, copy mentoring, and that is for brand copy and content storytelling that turns your truth into client catnip, energetic recalibration that helps you unhook old learned limitation patterns, keeping you quiet, not being seen, not being heard, real-time, high-touch, one-on-one coaching that actually sees the bigness of your vision, and the kind of sisterhood that does not flinch when you show up in your full, messy, brilliant, phoenix rising from the ashes glory. This isn't surface level support. It's deep, potent, paradigm shifting work that changes who you are as a woman in business and a woman in life. We start in August. Early open access is open right now. For the month of June 2025, inside of this early access open doors period, you will receive juicy bonuses, extended payment plans, and access immediately to my entire library of storytelling gold. You'll find all the juicy details at kyliepatchett.com/potent. And we fill spaces, and there's only 10 of them, and more than likely only 5 by the time you listen to this, because by that time I will have offered them to the existing cohort, the beautiful original OG circle. We do actually take applications on a first come, first served basis. So come and apply, and let's get back to the magic of the episode.
So at 54,
Yeah.
I reckon I've just gone into straw -1. So for anyone who hasn't got familiar with the straw categories, you go in through your reproductive phase, so from teenagehood, when you're still fertile. Straw -1 is when you start having slightly irregular periods, and the first thing that happens is you stop ovulating, so you lose your progesterone. That's the highest risk time for anxiety, insomnia, depression, that kind of thing. And then straw -2, your estrogen levels go down, and you start to have bigger breaks between your periods. I'm not quite at the 3 months between periods. I'm sort of going 6 to 8 weeks now between periods. But so I'm lucky I managed to avoid the mental health sort of stuff. I'm not a great sleeper, but I suspect that's genetic, and it's not terrible. I've never had that many hot flushes, except for when someone texts me and says, why are you not in the meeting? And it's a meeting, it's not in my diary. It'll give me hot flushes. But other than that, I'm not too bad with that. But what I did have was the floods. So it turns out, despite my Mirena, Mirena is an IUD that just puts out progesterone. I had that put in when my third child, who was about to turn 26, was born. I turned up to my 6-week check to my doctor with the Mirena, said, while I'm here, do you mind shoving that in? And I've just done it every 5 years ever since. And I started flooding, like I was sitting on 9 radio, and I could feel that the tampon had come out in my underpants, and it's the walk of shame. There's quite a long walk from the studio down to the bathroom. I didn't have a jumper to tie around my waist. And that's when I thought, I better do something about this. And it turned out that I had something called an endometrial polyp. It's completely benign, but I had to go back in and have surgery, have it removed, have my Mirena replaced. That's all sort of settled down now. But the thing that I've been really protective of is my vagina. I don't want any of the vaginal symptoms. So I've been very proactive. Actually, when my doctor put in the second last Mirena, she said it looks a little bit dry, even though I'm only in perimenopause. So she prescribed vaginal estrogen for me. I've been on that for like 3 years. And I'm not stopping that in a hurry, because I don't want to develop a problem with my vagina. But other than that, I've had a reasonably easy time. What that doesn't mean, Kylie, is that I dismiss everybody else who doesn't have an easy time because I haven't had it. Because there's a tendency for some of our sisterhood to not have the most empathy for their sisters who are going through shit, because they say, well, I was fine, I got through it and I was fine. And that includes a very large number of women in our mother's generation who had something radical, like a complete hysterectomy for menopausal symptoms, which, guess what? That's not going to work. But it doesn't, just because I haven't experienced it, I almost haven't met a symptom I haven't, that I haven't seen in my practice. I've seen it all. I believe all of it. I believe whatever you tell me, because I know it's real. I see it every day.
I think this is something that we were alluding to before we started recording, which we will get to, but I do see this all the time. I mean, I'm in a few friend groups, particularly from science, where I'm like 10 years younger than the majority of them, just by chance. I'm actually just about to go sailing with them today. But I remember at the time that they were all kind of going through this perimenopausal state, some of them were really struggling, but at the time we weren't even talking as friends, and we like talk about everything. Like there's nothing, So there's that going on. So number one, our sisters before us are not talking about whether it is a struggle, but also there is some friends in that group as well that had no issues at all. And so, the response to, like, I just put up an episode about my mental health struggles in perimenopause a few weeks ago, and I got some very interesting comments from friends. Like, what the fuck are you going on about? Like, this is garden variety depression. I'm like, no, it's not. It's to do with the fact that my progesterone has nosedived. And so I think that is really important to understand that. And also it goes in the other direction. Like, we need to understand that there's this full gamut of experiences, and to not diminish anyone's experience, either by saying, oh, you're lucky you don't have anything, or, get over yourself, push on through. And I think that there's definitely hearing you about the mothers of our generation. Like, I didn't have any trouble, so why are you going on with all this pork chop nonsense? And I'm like, maybe because we're a little bit more informed. When you raise the protective of your vagina, one of the things that I loved about in the book was you talk about that's something that once it's happening, those vaginal symptoms, you can't really get it back. So given that you've raised that, let's go there. And I think this is also something that, unless you've got a really great GP that you feel very comfortable with and, you know, that you can have that conversation with, do you find lots of people are suffering in silence and then it's too late to fix?
So I proactively talk about vaginas with my patients. And if someone comes to see me about menopause, I straight up ask.
Yeah.
Don't worry, I'll ask you about everything else first.
Excellent.
Before we take it below the belt. But statistics show us that only 7% of women will ever bring it up with their doctor. Now, those numbers are pretty sad, and I'll explain why. By age 65, about 80% of women will have some sort of vaginal issue related to menopause. 65 is young. Like, I don't think anybody wants to retire their entire sex life at age 65. If you have a partner and you have a male partner and the male partner happens to have prostate cancer and now they have now got impotence because of some of their treatment and it works for you and it works for him, I don't have an issue. But your vaginal issues are not just about sex. There are itches. There are strange smells. There is urine problems. There's incontinence. There's urinary tract infections. There are so many things. And unlike hot flushes, so if you wait out hot flushes, well, 20% of women still have hot flushes in their 60s, and 1 in 20 women will be super flushes. They flush forever. For the vast majority of us, they peak at about 1 to 2 years after you've gone into menopause proper, and then they do start to go away. So if you really think your hot flushes are not that bad and you're quite happy not to get any treatment for it, all power to you, that's totally fine. And you can eventually wait them out. The complete opposite is true with your vagina. So year on year, it gets worse. Month on month, it gets worse. And if you leave it and after 10 years, you come back to the doctor and go, you know what, I really need to fix this now, the amount that we can fix it, the ceiling that we can get you back to, we can always improve it, but it comes down a lot. So it means that I can fix it, but I can't fix it that much for you. So the sooner you get onto it, the better. I really feel that we don't tell women this. We don't tell women that time is important for you, and don't wait. Don't wait till your vagina becomes unbearable, because then we can get you back to uncomfortable but not unbearable. Well, for me, that was never going to be good enough. So I wanted to be really proactive in that space to actually fix my vagina before it ever fell into a hole. When my doctor noticed something, that was enough for me. Yeah,
exactly. I didn't actually realize that was something that was there's a limit to the amount that you can improve it until I read your book. So I was like, see, this is why we need to be having these conversations. We need to be writing these books, and we need much more awareness. One of the things that's disturbing me in my friend group and also a couple of clients is I've been told lately, I've gone to my GP with this symptom, and this symptom, all very clearly. One of them was told, you're too young at 49 to be in perimenopause, and just shunted out the door and left in tears, and then has been listening to this podcast, but also listening to these conversations going, hang on a minute, that's not right. Like, I might not be as informed as, someone who's written a book about this, but I know that my body doesn't feel the same as what it used to. And so that, and also the secondary thing, which has happened 3 times in the last couple of weeks, going to a GP, asking about HRT and being told without any history, no conversation about risk factors or anything, HRT is dangerous, you cannot go on it.
Okay, so there's a bit to unpack there.
Yeah.
Doctors are not taught anything about menopause in medical school.
Yeah.
We're not taught about it in general practice training. And if you want to learn about menopause, that as a doctor is on you. So for myself, I am very fortunate. I host a podcast for doctors in which we have kind of the best experts in Australia coming on. And it was just this light bulb moment where I realized, wait, I don't know anything about this. And this sort of happened in my early 40s, but I realized I'm seeing these women every day, and I can't service their needs because I don't know anything about it. So it was that bingo moment.
Yeah.
So that was the first thing that happened to me. And I was in a position where I could say, I'm going to join the Australasian Menopause Society. And then I got more obsessed and joined the International Menopause Society. And it's a really amazing group. And it actually has, multiple webinars and podcasts and information sheets. And as a member of the International Menopause Society, they have an amazing journal, medical journal, which is peer-reviewed. Wow. The editor is one of my mentors, Rod Baber, who used to be the chair of the International Menopause Society and the Australasian Menopause Society.
Wow.
High-quality stuff. You can get that information. Do you know what the barrier to entry is? I think I just paid up my 3-year membership for the Australasian Menopause Society. I could be wrong, but I'm pretty sure it was around $380 for 3 years of membership to get all of that stuff. It's not a big ask, right?
Yeah.
I mean, to sit an exam to be a GP, you got to pay over 10 grand.
Yeah.
So it's not a lot of money, but you need to have the interest. At the time, and I get it, GPs are super, time strapped. I totally get that. But the information, you can get it. It is a little bit complicated. Like, GPs are really good at doing blood pressure. And the reason is because with blood pressure, if you go in and your blood pressure is above this number, right, you prescribe one of these 2 drugs. And if that doesn't work, you add 3rd drug. And if that doesn't work, you add the 4th drug. And then on the 5th drug, you refer to a specialist.
Yes.
It's pretty easy.
Yeah.
The machine, the blood pressure machine, tells you what the blood pressure is, and you just go into automatic pilot mode. Menopause is much more difficult.
Yeah.
There are, 30, 40 different symptoms that constitute particularly peri, but also menopause.
Yes.
There is no test for it. I know I get asked all the time for more blood tests.
Yeah.
They don't help you. We don't do blood tests.
No.
And they do not help direct which hormones you get from a bioidentical hormone specialist. That's complete garbage. We don't do that. So here we have a situation in which the symptoms are variable. You need to have your radar honed in case it could be perimenopause. You need to be asking about how regular their periods are. Yep. Because if someone in their late 30s comes to you with all the symptoms that could be peri and their periods are only coming every 6 to 8 weeks, you've got to be thinking about it.
Yeah.
And with all of that, the treatment is really different for every person. So I understand why it's hard.
Yeah.
And so I understand why GPs are simply not wanting to do it. And also, do you want to talk about the study that came out in 2002?
Yes,
because
please.
That was a big turning point. So for anyone who doesn't know, we in the medical world love what we call a prospective trial. So most studies are what we call cohort studies. So we look at a whole group of people at 60 and we go, what did you used to eat? How much exercise have you done? What did you used to take? And they're notoriously inaccurate because most of us don't even remember what we had for lunch yesterday.
Exactly.
What we ate a year ago.
I can't remember what I had for breakfast today.
Right. So they're notoriously inaccurate, which is why we give them a bit like we give them a low score in terms of science. But what consistently was coming up in like the 1980s and 1990s was that a lot of these cohort studies were finding that women who were taking hormone replacement therapy had less heart disease.
Yeah.
And as a result, the National Institutes of Health in America that have the money to do these huge studies recruited a massive number of women. It was over 100,000 women to a trial. And they said, what we're going to do is we're going to put half of you on a placebo and half of you on hormone replacement therapy, which, by the way, they used the most available form that was available back in the 90s, but is no longer available. Or you can still get it, but no one would use it because it's not a great form of HRT. It's a little bit less safe. And so they took these women. The average age of the women that they recruited into the trial were age 63.
Yeah.
They didn't ask them whether they had menopause symptoms because that was not the point of the HRT. The point of the HRT was to see if they could prevent heart disease, and they kept measuring different things. When it came to they were randomly assigned, but it turned out that almost half of the people in the HRT arm were age 70 when they started their hormone replacement therapy. They also tended to be overweight. And then they sent them off either on HRT and placebo. And here's what they found. For every 30,000 women taking a placebo, 30 ended up developing a breast cancer. But for every 30,000 women who took the HRT, 38 developed a breast cancer on the HRT. So 8 more out of 30,000.
A lot of,
out of 10,000 women. So as a result, they stopped the trial and they said this thing causes breast cancer. And as a result, about 80% of women threw their HRT in the bin. But more importantly, doctors got sued.
Yes.
They got sued. They had the pantsuit off them.
Yeah.
And to this day, despite the fact that subsequently multiple scientists have gone through this study and said it makes no sense, it did not cause, if you took the group of women who started it in their 50s up to the age of 60, they didn't have any more breast cancer than the women who are on the placebo.
Yeah.
Despite that, there are black box warnings today in Australia on every form of HRT, and doctors are terrified of being sued.
Of course
it's a horrible experience. I don't want to be sued.
No.
And I would take a defensive crouch and say, you know what, if you want that, go to somebody else.
Yeah.
They can take the risk on you suing them. I don't want to get sued. So I completely understand why doctors don't want the knowledge and don't take the time to upskill.
Yeah.
It is difficult. It is not straightforward, unlike blood pressure, and they could get sued.
Yeah.
Who wants that? So if you are brushing up against your doctor being in that position, I don't blame your doctor, but I do think we do need more education.
Yeah.
And we do need to empower women more to say, I really want it.
Yeah.
And this is what I want.
And I think that to me, and, you know, this is not a possibility for every single person, but advocating for yourself and being really well informed before you go to a doctor is so important. And I think, I don't know, this comes naturally to me because I spent the first 10 years of my professional career in hospitals, you know, interacting with doctors, and I don't have that. I think there's still some people that are like, the doctor must know more than me. It's like, you know your body the best. And so then if you're really, really interested in actually understanding something, then you need to be advocating, and if not, finding a different GP. This Tuesday, you are actually heading somewhere very important to actually try and get some funding for better education, etc. Can you talk to us about that?
Yeah, so I'm going to Canberra to talk to a parliamentary round table on menopause. It's being co-hosted by Bridget Archer and Peter Murphy, and really Peter Murphy's been amazing. She's been so proactive in this space, and hats off to her and great thanks for pulling in all of her buddies. We've got Greens senators, we've got Teals, we've got people from every party. And we're a little thin on Nationals. If you're a National Party person listening to this, please come.
Yes.
But we have got men coming, women coming, and we're asking for a lot of things, actually. We're not just asking for more education for GPs and gynecologists and endocrinologists who also need more education, because a lot of them don't get it either. But it's also you know, because not every doctor is going to feel comfortable in this space. I could be offered all the education around men's health and erectile dysfunction. I'm probably not going to step through that door because I'm not good at it. I know where my limitations are. I'm not
And it's also not an interest, right? Like, we should be okay with GPs, you know, following what they get most fulfillment and passion out of, and becoming, you know, more, I know GPs are not supposed to be specialists, but, you know, more specialized, more educated, more informed about that particular thing.
I think yes, except for what really ends up happening in particularly small country towns in Australia, where you're lucky to get into any GP, let alone somebody who has a special interest in what you're interested in. And you're lucky if you get more than 10 minutes. And so there are private telehealth services, and one of my girlfriends runs the most amazing telehealth service, which is WellFem. Which she's based in Canberra. She has multiple doctors working for her. She's very careful to ensure the quality of the medical consults that are coming there. I know I'm not meant to advocate for other doctors. I think that could be a bit on the smelly side. But, you know, I'm saying that you can get telehealth consultations, but they don't come, they're not bulk billed, and they're not cheap. And there's an equity issue there. I mean, I can't believe that an issue like menopause, which will affect 100% of women who are lucky enough to live long enough to go into menopause. We're not talking about fertility issues. We're not talking about painful periods. They are terrible issues for the women that they affect. This is going to affect every woman. We are 51% of the population. I can't believe that is an issue that only wealthy women can get dealt with. That is just outrageous.
That's crazy.
And similarly, the forms of HRT that are available on the PBS. Weirdly, the form of HRT that I told you about, which is not considered best practice and is not considered safe, you can get that on PBS. government will pay for that. If you want the safer forms of HRT, no, you're probably going to have to pay up big time for your own HRT, and it's expensive.
and
it precludes, I mean, it's the most inequitable thing in the world for women. And I can't believe that as a group, and we particular Gen Xers who've come to menopause, we are educated, we have university degrees. Our mothers were the trailblazers. They had to fight for our right to vote, our right to get a divorce, our right to get tertiary education, stay in the workforce. We're the beneficiaries. How the hell are we not advocating for equity for our sisters who can't afford this?
Yep.
This is not a rich woman's disease, and it's outrageous. I'm outraged. So I think that we're arguing for that. And my particular issue as well is around access to help women in workplaces.
Yes. Let's have
when
that
you see
conversation.
the statistics around workplaces, it's unbearable. Again, it's not only CEOs. We're talking about women who do our factory work, who pick our fruit, who do the most important work, who are our teachers, who are our preschool teachers, our nurses, our occupational therapists, are in droves having to stymie their careers because of a condition that affects 100% of women, and partly because of the lack of equity in the system. So I'm really passionate about workplaces, but we're all going to argue for a whole series of things, awareness campaigns as well.
Yeah. What would you like to walk away with? Like, what would be the high five moment with all of those people that have been pulled together?
Look, you don't go to Parliament, introduce a concept like that and get them to pass legislation that afternoon.
But let's wave a magic wand.
Yeah. And I mean, part of what we want is more money for research. And let's be fair, medical research comes out of very specific pots that are not determined by the government, and nor should they be politically driven where medical research goes.
Yes,
that's
absolutely
very scary stuff. So we're going to argue for more money around research, but really that's going to come out of the medical research super fund, or it's going to or it's going to come out of the NH and MRC fund, grant funding, and as it should be, arm's length. But I think what we want is for parliamentarians who are in a position to argue within cabinet, to draft some legislation, to say this is a good idea, and those who are in a position to either block it or support it and make it a bipartisan or tripartisan piece of legislation. So we want Greens to support it. We want Teals to support it. We obviously want the coalition to support it. But right now we have a Labor government in power, and what we want is for some sort of bill to come through Parliament which entrenches equity for women, that recognises it as an issue that is reducing revenue for Australia.
Absolutely.
It is costing Australian taxpayers money. It is costing you and I money, because our taxes are going to put women into the aged pension at an age they shouldn't be in an aged pension. They should be in the workforce if that's what they want to do. And I encourage that, because it's good for your brain, and dementia is a women's disease. I want you in the workforce. I want you feeling empowered to, yes, your parents are putting stress on you. Yes, you've got teenage kids, but it doesn't mean that you need to take a massive haircut on your salary because of some symptoms that are, I promise you, I do this every day for a living. It's super easy to fix people with menopause. So why should you have to resign your job or go and take, how many times, Kylie, I speak to women who they had assistant branch manager at a bank. Couldn't handle it, no support from the workplace. They're now a receptionist in the dentist's office 3 days a week on 30% of what they were earning before. Their super is now taking a big hit. And we can't work out why Australian women retire with 40% less super than men.
Hello. Not
It's
only
not
are we
okay.
taking time off for babies at the front end, now we're taking time off for menopause at the back end. I was saying to you before we started recording that in October last year, I chose for many different reasons to walk away from a corporate job. And one of the things that I said to you was, I felt like I had like massive mental health issues. I also had, a dementia thing going on and stuff with teenagers, the normal sandwich generation. I'm not a pioneer. But at the time, there is no way that I would have felt comfortable going to any of the layers of management above me, who all happened to be male and all happened to be 50s to 60s. Actually, probably my immediate reporting manager I could have, But anyone above that, and certainly not overall in the organization, it would have just been because exactly why you were saying before, some of the levels above me were women who have gone through menopause, and I reckon would have rolled their eyes and just gone, are you flipping kidding me?
Yep, I did it. I was fine, so therefore you must be fine.
Yeah, exactly.
I want to implore the sisterhood, and this is, for any listener here, if you encounter that kind of attitude, I think it's good to validate their experience of menopause and validate the fact that they did an amazing job of getting through that and holding their career together. And that is impressive and good for you. I'm super proud of you. But for the sake of the sisterhood, can we think about women who either have no idea what the hell is going on, so are in no position to even go and bring this to the attention of a doctor, or butt up against a doctor who goes, nah, you're 49, you couldn't possibly be in menopause. They haven't even heard of the word perimenopause.
Yeah.
Or they butt up against a doctor who go, yeah, probably is menopause, but it'll pass, so don't worry about it. HRT is dangerous, despite the fact that when it comes to mental health stuff, we know that hormone therapy works much better than antidepressant medication.
Absolutely.
And it should not be the first cab off the rank for women with mental health conditions in peri, which, by the way, is the highest risk time of a woman's life.
Yes.
There is absolutely rightly a lot of focus on postnatal depression, as there should be, and on teenage girls. There are government interventions and government services all over the show. Good for you. However, if you look at rates of depression and rates of suicide, they peak for women between 45 and 55.
Yep.
It is all hormonal, and those women get no special services. They get no special nurse who comes over and does a health check on you. There is nothing. And they have doctors who at best go, here's an antidepressant, and at worst tell them to pull their socks up.
Yeah.
And there is no support at work. So I think that for the sake of the sisterhood, we who have been lucky enough, and I was telling you at the start of the podcast, I have been lucky enough not to have had mental health issues during my perimenopause journey. But it doesn't mean that I won't fight hard for the women who have, because that's my job. Not because I'm a doctor, not because I have the ear of the media, because I am a woman. And that's what we women do. We have to fight for each other, not go, I survived this, so you're an idiot. I also didn't get postnatal depression. It doesn't mean that I want to ridicule women who have had it. It's really, we have to be there for each other. We have to step up for each other. And I feel like in my experience through Don't Sweat It, I've had so many men go, this is great. I'm so grateful. Thank you for teaching me about it. Yeah. More resistance has actually come from women. It's been shocking. I've been really, really devastated by it. Yeah.
Blows my mind.
Yeah. Yeah.
I just want to reflect back to you, and I'm sure you already know, but the passion and the conviction that you are sharing actually really affects me. Like, I didn't intend to cry, but no, it really does, because we need to be, holding space for all of the different experiences. And it's a funny thing, isn't it? Because, you said to me before, like, I don't think that any of those layers above you in that organization who are men would actually not want to know. Like, they want to know. They just don't know.
And they don't know how to deal with it.
Women do know.
But they don't always, Kylie. I mean,
well, that's true.
My partner in Don't Sweat It is a really well-known personality, Shelley Horton.
Yeah.
So she's been working like as a women's health journalist, interviewing doctors her whole life. She hits perimenopause. She's never even heard of it. And she just has no idea what's happening to her. This is a woman with tertiary degree, experience, like a well-paying job, access to information. She didn't know what was happening to her.
Yeah.
And as a result, she lost 9 months of her life because she couldn't advocate for herself, because she just didn't know what the hell was going on.
Yeah.
She never had depression before. And all of a sudden, she's sitting there with her mental health in her bootstraps, just going, I can't handle this. I can't cope.
Yeah.
And without the empowerment to understand what was happening to her. And, we met with a very big organisation, and somebody said to us, but this is just not happening in our organisation. We're not having anybody with menopause in our workplace.
What? Sorry? All males work there?
maybe nobody over the age of 30. I don't know. And so, yes, with this, we certainly don't need any intervention in the workplace because it doesn't affect our workplace, which was curious. But, we need to be podcasts like this, people sharing, being brave enough to share their stories. And that's not for everyone. And if your story is personal to you, be a passive consumer on the sidelines, and maybe in the secret sanctuary of your best friend or your sister, you can talk about it. And no one should be shamed for not being out about it. We need a gamut of different people who take different levels of outwardness around this, and that everybody's journey is their own. And I respect whatever journey you want to take and whatever path you want to take. But those who feel that they can share, it makes such a huge difference. It really does make a huge difference. I promise you. There are doctors who are still saying that menopause is not causing women to leave their workplace. Now, these are doctors who are menopause experts, who are saying that they're perhaps more academic than seeing patients. When I put up an Instagram post, and the two themes coming through from comments is, my doctor told me I don't have perimenopause, or I can't have HRT, and we've got to be talking about this at work because this is just, I nearly quit my job. That is the reality. That is what is happening. The statistics bear it out. The Australian government statistics bear it out. Kylie, the Australian Institute of Superannuation Trustees has put a dollar value of women resigning early because of perimenopause and menopause symptoms at $15 billion a year. $15 billion a year in Australia from lost income and lost superannuation. These are women who now, the biggest risk of homelessness. They retire with less super. They get stuck in toxic relationships that they can't afford to leave. They end up on pensions when they shouldn't need to be on pensions. As a country, that is too much money. If you don't give a shit about the women and what they're going through.
About the people.
I do. But even if you don't, even if all you want is for your taxes not to go up, that should matter to you. Because that's a big number that you and I have to foot the bill for. I'll happily do it because I want to advocate for those women. But
me too.
As a society, we should be up in arms about this.
Oh, yes, 1,000% yes. One of the things that I wanted to ask you about in terms of, I know I'm circling back to the HRT thing, but something that was really clear in your book was how you tailor HRT to symptoms. And I don't know, I don't know, I've only got the one GP. I've only had the one experience in this, time of my life. And I'm similar to what you're saying about Shelley, like I'm a biologist by training, worked in, medical science for a long, long time, get to 47, start having rage and crying in, 2-second swings and have no idea what's happening, like totally blindsided. And I'm like, I wrote a post about it the other day because I'm like embarrassed. Not that we should be, but and I keep on sort of saying to people, if you're being blindsided by symptoms or you just have all of a sudden got stuff going on that you don't, please, read good books, make sure that you can actually understand, because there's so much that it can be done, which is where I was going with the HRT. So when you have someone come in that has got the end of the symptoms that are, preventing their ability to sleep, have calm relationships, good mental health, etc., the ones that are going to end up with I was talking to someone the other day and she said, C-suite, end of professional career, and in the toilet multiple times a day crying because she doesn't feel like she can cope mentally. When you were talking about HRT in your book, though, you were very particular about different types being best for different things. Can you give us a little bit of an idea, not specific types, obviously, but just that if you've tried HRT and it hasn't worked, that there's maybe other things that you can be trying? So I know that's a big question.
The way I approach this when I have a patient in front of me is the first place I start is to tell me about you and your life and what does a day in your life look like. Because that helps me understand what your challenges are.
Yep.
Who's at home, who you were caring for? Are you a single mum? You know, are you okay financially? Whatever it is, that's really important. Then we'll go through her symptom checklist, and then I'll circle back to what is most important to her.
Yes.
And what is she looking for?
Yep.
And what, you know, just because I've ticked yes on my symptom checker that she does have hot flushes doesn't mean that that's particularly worrying her.
No.
I'm amazed by the number of women where weight gain is the thing that is the most concerning for them.
Yeah.
Some women have completely horrific sexual dysfunction and don't give a rat's about it. That's fine.
Yeah.
So I need to know what are you most focused on fixing?
Yes.
What are you open to doing? Because if a woman says, I don't want to talk about hormone replacement therapy, then I'm not going to talk about it. It's just, that's not my role, is to try and convince you to take something you don't want. My role is to try and meet you where you're at.
Yeah.
So that's the first thing. Let's say we've gone all the way to the fact that we have settled on HRT being a really good thing for you, and this is what's going to work 100% for you. Then within that, there are multiple choices, right?
Yes.
So one of the things that I need to know is, do you have a uterus? Which is going to sound weird.
Yeah.
If you have a uterus, and we give you estrogen, which will probably do most, but actually not all of the heavy lifting in terms of your symptoms, we could potentially give you uterus cancer, which I don't want to do that. So
no, best not.
We have to give you progesterone.
Yep.
And there are a number of ways we can give you progesterone. One is actually directly into your uterus to protect your uterus, and that's in the form of the Mirena, which in my case is the contraceptive. And HRT itself is not, it's much lower doses than the pill, so it doesn't give you any contraception at all. So if you take HRT and you're still having regular periods, you'll continue to have periods and you'll still be ovulating and you could still get pregnant. So that's don't take it and think it's the pill. It's not.
That was a surprise, baby.
So if you still need contraception because you've got to 48 and you've still been doing the withdrawal method, or I don't know, you have been on the pill, or you know, you've been using condoms but they're not working for you anymore, then we could even talk about doing an IUD. But if not, we could talk about progesterone, and the safest kind of forms of progesterone is what we call micronized progesterone, which you take at night, because progesterone is an amazing sedative. So we always take that at night. And then how do we combine it with estrogen? So estrogen comes in a number of different ways. In Australia, far fewer than there are in Europe and the UK, but we do generally have tablets. The advantage of tablets are, by the way, micronized progesterone is really expensive. It's much more expensive than the subsidized forms, which are the less safe and effective forms of progesterone. But if you can afford micronized progesterone, then I would say we can give that to you at night with the same estrogen in a single pill. If you tend to be a little bit vague and you don't want to have estrogen happening on one arm and progesterone on another arm, this might be a really good option for you, but it is oral estrogen. Oral estrogen tends to cause more bloating. It tends, so if you're someone who gets bloating, you might not even want to try it. It also tends to, it can set off migraines. So if you've ever had migraines, I tend to say, look, I wouldn't. And also it has been associated with a slight, not massive, but a slight increased risk of clotting. So for women who know that they have a clotting disorder, so if they might have something like a factor V Leiden or some other sort of known clotting issue, or they've had what we call a non-provoked VTE, venous thromboembolism. So that is not, I had a knee replacement and then had a clot. That's provoked. That's caused by the knee replacement. But if you just randomly got a clot somewhere, we don't tend to use oral estrogen. We'll use what we call transdermal across the skin. Now within transdermal, we have multiple choices. So we have patches and we have gels. Within the patches, we have great big patches. Big advantage of the great big patches is you only have to remember them once a week, which is super good. Disadvantage, they tend to get a bit manky by the end of the week. And I've got patients who come in with like tape all over them, and it's like, it's now looking like a jetpack. Not looking great. We've got little mini patches that you do twice a week, and then we've got the gels that you put on once a day. There are two types of gels that are available. One that I absolutely hate. It's very slimy. You have to use masses of it. It falls all over the floor. I don't like, and then pick it up off the bathroom floor and try and rub it everywhere. There's another one that's newer that I like much more. But again, none of this stuff is cheap. So I need to understand your financial circumstances. So I need to, that consultation, just walking you through your options, that takes forever.
This is what I was going to ask.
Got to decide, right? So don't go in and think you're going to be out in 5 minutes with HRT. It doesn't work like that.
I think to me, the outstanding thing, like I've heard of all of those things, but I really love how in the book you're very like, first of all, I would try this, then I would try that. Da, 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 da. And to me, when I hear someone being told no, HRT is not possible, or I also have a lot of friends that have tried HRT, but only one type, and said, oh, no, it causes more trouble than it's worth. And I just want people to really hear there's multiple different options, multiple different forms. Some are better than others for particular things. So, if you don't have a doctor that knows that degree of, then what would you actually suggest? So someone goes to their doctor, they're only being offered one. Do you say automatically go and find another doctor, or
it depends on what it is? I think all you need to do is say, I know there are lots of different HRT options around.
Yeah. Okay.
You've suggested this one. Can I ask about your recommendation and can you walk me through why you've recommended that one?
Yeah.
So, for example, I've had patients who've taken a combination oral HRT product.
Yes.
And they've been told to take it in the morning. You're going to feel terrible if you take progesterone in the morning.
Yeah. I take progesterone at night and I would not want to, I couldn't function.
You can't function because it's sedative. So you can't, so if someone doesn't tell you to take it, and some pharmacists are telling people to take it once a day in the morning, or if the prescription just says once a day and you're like, well, I know what I did with the pill, I always took that in the morning. You don't want to take your HRT in the morning. So I would really recommend that you take it at night.
Yeah.
But if you don't know that, of course, you can feel really groggy. And if somebody doesn't tell you that it can cause a bit of stomach upset, oral estrogen, then you might just go, I felt sick on the guts. I felt exhausted.
Yes.
And it didn't work for me.
Yep.
So I would you don't really need to go into everything that I go into in the M word, which is all the details about the different options.
Yeah.
Mind you, when I wrote it, the gel that I now prescribe a lot of was not available. So I do need to update the book. But
I feel like I need another sticky note.
Yeah. But I do think, though, all you need to know is that there are so many ways to skin that cat. And just if your doctor only offers you one, work out why. And if you're not being offered micronized progesterone, I would just say, why is that? Because a lot of the combination HRTs that are on the PBS, and that might be the most important thing to you, that I can't afford to take the expensive forms. But even then, I think you should be given options, because one of the things that it's not recommended on the packet, and the drug companies that make micronized progesterone don't recommend it. But in France, they often use the same tablet that you take every night orally. They often use it 3 times a week as a vaginal suppository, because that gives you the same endometrial protection. And for women who don't have a lot of money, that's often what I'll say to them. Do you want to just do it that way?
Yeah.
Because then you're using half as much, because you're doing it 3 times a week. You just got to remember to do it.
Yeah.
But that's another option for you. I just want women to have options.
This is why, That's what I wanted to ask.
Yeah, just so that they can get comfortable with it. And doesn't mean you have to have it. If you don't want it, totally cool. We'll work with that. That's fine. But I just want you to not take it off the table because it's never presented as an option to you.
Yes, absolutely. And going back to what you were saying about that early study, when it was, probably misinterpreted and then created such a huge response with people coming off HRT, etc. We've come a long way. There's much more, a huge body of evidence to say that HRT is safe in specific ways, etc., etc. Something that I wanted to cover too, in the book, you talk about the sleep. Actually, something that was really, really clear to me in your book, like every single chapter, you say the lifestyle factors. Let's move, let's eat well, let's prioritize sleep, because sleep, lack of sleep makes everything worse. Can you talk a little bit about that? Because I think, we can get very complicated with, the things that we can do treatment-wise, but we also need to be, self-responsible with how we're actually dealing with ourselves in the first place.
So I'm a doctor. I'm always going to say that you should be sleeping more, exercising more, eating the right foods.
Yeah.
I often see women who come to me who are in such a mess in terms of their mental health. They're not sleeping. They've got hot flushes. And for the starting blocks to be, go and do exercise. It's not like they're idiots. They know they should be doing more exercise.
Yeah.
They know what they're eating is shit. It just feels like more scolding, and it adds to their burden of feeling like a failure, which the confidence cliff is so huge for women in that position. So it's never my starting position because it's mean. And what I want to do is acknowledge that, of course, you're not exercising at the moment. You're wetting your pants, you're sweating, you don't have the confidence, you're exhausted.
You're tired.
You're tired. Like, let's put that out there as just, it goes without saying, your life is going to get better if you can do all those things. But if we can get you to the point where your mental health is better, you're sleeping, you're feeling a bit more in control of your life, you're feeling like optimistic that things are going to get better. If you're not hot flushing right through the night or having, some women don't, it's not that they're having hot flushes. In fact, more women to me just say, I'm just hot all the time.
Yeah.
I used to be a cold person. I was always that person who my husband had to lie on top of me at night. I couldn't get warm at night. And now I'm like, get off me. I am so hot. You know,
I'm like that.
If you're just running hot all the time, then a bit of HRT is probably going to fix your mental health, fix your feeling hot, fix your aches and pains. And now, second cab off the rank is going to be the lifestyle. And it's not that it's less important. In some ways, it's even more important. But I'm not going to put that onto you. That's just cruel. And so what I do know, though, is that there are some menopause specialists who just keep upping and upping the dose of estrogen.
Yeah.
And there's simply no evidence from any studies that more estrogen is going to help more.
Yeah.
And I have concerns about that because we need to keep your endometrium, your uterus in mind. And if we keep putting up the doses of estrogen, are we going to accidentally tip you into a spot where you could be at risk of endometrial cancer? My preference would be to say, let's muck around with it, adding in a few other things. If you're just running hot, let's maybe add in another medication. Some of the specialists I spoke to write the M word actually use some of the complementary and alternative therapies, things like black cohosh, to add in to help, even though we have no data about black cohosh and breast cancer, by the way. We can't tell you that it's safe. But what we can tell you is maybe that will help. Maybe the two things together will work to just bring your hot flushes under control, to get you to the point where now we can hand it to lifestyle. And with that, we'll kick the ball through the post. But I just want to acknowledge that any doctor who says to you, well, your problem is that you're fat and therefore you just need to go on a diet, which I hear that all the time, is super judgmental. And it makes women who, it's that confidence cliff that I hear all the time. The women I speak to feel like they are parenting fail, partner fail, work fail, daughter friends fail, friend fail. Their friends are going through shit and they're not returning the calls because they just feel like they just can't right now. You are feeling that you are failing on every level. I don't need to add exercise fail, diet fail to your list of fails that you've put on yourself. Let's get you out of there. And we'll just say, it's coming. It's coming. Don't worry about it. Just, you're not a fail. No one's doing as much exercise as they want to. No one's having the great diet. I would love to be drinking less than I do. And every night I come home and I think, I'm not going to have a red wine tonight. And then I do have a red wine because I really like it and because I have a fucking stressful life. And it's okay. It's okay. I'm not going to beat myself up about it. We can't do every single thing perfectly. I don't drink a bottle a night. I have a glass a night. It's okay. And I just think we've just got to be helping each other as the sisterhood and going, what you're doing is great. This is tough. You're going through, it's tough. Let's just focus on what you're doing well and get you to the next step, one step at a time.
I'm so glad I asked that because, I look back at myself in October where I just felt like the walls were crashing down. And for me, progesterone at night has been a huge, I sleep, my mental health is much more stable. I've got that, sedative, calming sort of effect going on, and I feel back to myself. There is no way that I would have been able to all of a sudden go into this strict lifestyle routine. But now I am very able to, and it is now part of what I see as that holistic, making sure that, I can, cut through the stormy seas sometimes with that deeper keel of like, okay, so I am moving and I am prioritizing sleep, but also prioritizing playtime and connecting with friends and like all those things that make us feel good as human beings, right?
And then make us able to do the jobs that we feel we owe other people, because women are all carers.
Yes.
So women, we feel like we owe our children X, we owe our partners X, we owe, our husbands Y, we owe the workplace. Yes, I know it's not in my job description, but I should be doing it anyway.
Yeah.
Okay, if you feel that because you've got a lot of girl guilt, and that's probably, you need to unpack that with a psychologist, whatever. You can't do the things that you believe that you have to be doing if you are feeling like 10 tons of shit. So if you don't invest in yourself for you because you think you deserve it, do it for the other people that you think you owe stuff to.
Yeah.
It's okay. Absolutely. I don't really care what your motivator is. Just go do it.
Do it.
Go look after you, because the world will be a better place if you actually do look after yourself.
Amen. All right, final question, because I have a question that's a personal one for this one. I want to look like Helen Mirren. So this is the final chapter in your book. I really would love to hear, and I know we're very close to end of time, how ESC came about, because you talk about in the book, like people are like, okay, now I've got these symptoms under control, but I don't want to all of a sudden look like I'm 110. I think that's probably for all of us. And yes, acknowledging the fact that, when you're not sleeping and you're raging through the day, you don't give two hoots about what your skin looks like. But let's talk about the Helen Mirren factor.
And look, there are some women who just are even offended at the thought that we would be discussing Botox in a book about menopause. I've never had Botox, but I have no judgment for women who do, and I've never had filler. But I've had lifelong struggles with skin. So I had terrible acne, I have rosacea, I have very sensitive skin, I have pigmentation. So skin, and when you're on TV, the only answer to all of that is just to pack on makeup. And I don't like that. That just makes the whole thing worse. So every time we would do a segment on Sunrise on what really works in anti-aging skincare, which were very popular segments, I would get an email saying, so what, but what products? You've told me I need 10% L-ascorbic acid. You've told me that I need a pH that should be like 3 or less, but hang on, I can't find that. What can you recommend a product? And I just say, no, I'm sorry, I can't find one. Here's the studies. The studies are super easy to find. We know what we should be looking for. I just can't find the product. The products are promising you like, stem cell regeneration and just shit that has just got no evidence whatsoever. It's so exploitative of women. Again, my passion is, I don't like women partying with their hard-earned. I work hard for my money. So do you. I just hate it. And so it was just one of those weird things that would just keep coming up. And then my husband one day said, what would be your absolute nirvana? And I went through all the ingredients that I would want. And the thing is, it has to be in this formulation. It has to be in the right, how can you put an antioxidant in a dropper, in a glass dropper?
Yeah, you talk about that.
Oxygen and light. It goes off, and off antioxidants are pro-inflammatory. On what planet are we putting a vitamin C in a glass dropper? I don't understand it. So I was like, I want an airless opaque bottle. I want this. Anyway, it was just one crazy conversation one night, and we ended up doing it. And so we started off, we had quite a few friends who are plastic surgeons and dermatologists, and we're like, why don't you do your own skincare line? They're like, because I don't really have time, but I'd love to. And so we worked with a whole lot of plastic surgeons and dermatologists, and we launched Aurora Care, which is the company that manufactures evidence-based skincare for dermatologists and plastic surgeons. We've got clients in Canada and Hong Kong and Sydney and New Zealand and Perth. But then we also had in 2014, maybe 2017, we launched ESK, or Evidence Skincare. And we launched that because the evidence is just so strong. And I've taken my skin from shit to pretty good. Like, I don't look bad for 54.
You look amazing. I'm like, oh my God, if this woman is not a poster child for her own product.
So, and I don't really need to wear makeup. I do on TV. I was on TV this morning, but I have hardly any on. Like, I have to dilute mine out with a hyaluronic acid serum because I don't like the thick, cakey kind of stuff. And it's been amazing. It's been an amazing journey. We just so we've got an office in the States, we've got an office in the UK. It does mean I travel quite a bit, which is good because I love traveling. So I'm very happy in an airport. But We were just the beauty editor of the Today Show, which is a nationwide show in the US, just nominated ESK's Ageless Patches as the most innovative beauty product of 2023.
Whoa.
So we sold out in a few hours and had to.
Congratulations.
Yeah, it was wild. We had done an order for MOQs, minimum order quantities, had gone up. So we'd done an order for what we thought was 12 months worth, and now at the sell-through rate we're doing, that was only going to be a few months worth. So we've got we've had to put another order in, but where it's what we do as well as we continue to evolve with the evidence. So if evidence changes, then we will bring in, we will change our formulation. So we don't die in a ditch over a legacy product. And we don't want to overly complicate things. There is no need to overly complicate things. So we are not going to keep legacy products because they sell well. From our perspective, what we want to do is just say, you know, if the evidence changes, we're adding this ingredient to an existing product, and we're happy to do that.
I just love the fact that your standard for yourself, like you even say on your website, like I'll never say anything out loud that I don't believe. And evidence is the key thing behind what I recommend. When I was pregnant, I had 2 kids in 12 months, so a pretty intense parenting journey. But I had really, really bad cystic acne for the first time in my life, all around my, chin area, and really bad pigmentation. And all of a sudden, probably since about 47, my pigmentation is really bad, particularly on my neck and everything. So I went on when I was doing my research before, and I love the fact that you've got like a little questionnaire or quiz, I guess, on the website that helps people identify. And I guess it comes back to almost like the HRT discussion, like what is it that bothers you? What do you want to solve the most? And for me, that's pigmentation. But when we're talking about anti-aging skincare, what are the things that we're needing to fix in terms of, because of estrogen, obviously, with collagen? So what do we see as we age?
So women lose about 30% of their collagen from their skin as you go through menopause within the first few years. And then you keep losing 2% a year as you go further and further from menopause. So I'd probably try and go into menopause with as much collagen as you can. Collagen is broken down by a number of enzymes inside the skin, and those enzymes are turbocharged by inflammation. So anything that is pro-inflammatory, from acne to sun damage, and sun is a huge thing, but even the wrong skincare. If you have a red reaction to skincare, that will break down collagen, unfortunately. So I would start I'd start as early as possible to go into menopause with as much collagen as you can possibly have. No, you can't get that from a drink. Sorry.
No, you can't. I'm very excited.
Yes, and I don't need to explain this to a biologist, but for anyone who's listening, your gut's job is to break down all proteins into their smallest units, because if they're not broken down into their smallest units, you can't absorb them through the guts. Your gut's actually, and thank goodness, because you don't want to absorb entire bacteria or parasites. Your body will actually break down every single big molecule into small molecules and then reconstitute them inside your own cells. You don't have the genes to be able to make marine collagen or bovine collagen. There's some theory now that taking a collagen drink might change the gut microbiome and make your gut less pro-inflammatory. That's a theory. It's never been proven. There is no evidence to support collagen in drinks. So no, and you can't put collagen on your skin because the molecules are too big to penetrate your skin. What does penetrate the skin is vitamin A is your big gun. Vitamin C, vitamin B3. There is evidence now for ceramides, for hyaluronic acid, those sorts of things. Ceramides and hyaluronic acid actually also decrease as you go through menopause. And what we call the dermoepidermal junction, so that's the border between the superficial skin and the deeper skin layer, which ideally when you're young, it's very curvy, like a roller coaster, so that there are lots of interactions between the blood vessels in the deeper layer of the skin, and they carry nutrients, and the top layers of the skin that are much less blood vessel rich. And that, of course, flattens out, and there's less exchange of nutrients as you get older and as you go through menopause. So there's a whole lot of things. You want to restore your skin barrier. You want to increase your collagen. You want to reduce inflammation. You need to have gentle skincare. You want antioxidants in your skincare. I am all about sunscreen as well. Just remember, most sunscreens, the SPF refers to the multiple of time you can stand in the skin before you burn. By the way, how we test that, is that we get people to put on sunscreen and then we expose them to very artificial levels of UV radiation and measure how red they get. That's what volunteers do. Kind of really weird. But what you can do if you put lots of vitamin C in your skincare is because it's an antioxidant, you can limit the erythema, the redness reaction. So there have been sunscreens that have been labelled SPF 50 that actually only have an SPF 5 in real world conditions because they limit the erythema, the red reaction, which is how we measure the SPF in a skincare, but in fact it's still doing lots of damage. So there's a whole lot of problem with the SPF, but you do need broad spectrum. It needs to say broad spectrum. Otherwise, you're not knocking out the UVA for aging rays.
Yeah. This just, I know we've talked about monetizing things, but the whole, like the collagen drinks and that, like all of the, it's like, please be an informed consumer. Please do your research. And I know that's not everyone's cup of tea. And if you don't want to do your research, buy from brands like Esk that actually do the research for you and have evidence base.
And we'll link it. We link it. There are click-throughs to every study. You want to read the original science? It's all in there.
Go for it.
We've got a compendium of like 10,000 studies that we have got downloaded in our library.
But I know the scientists of me.
Yeah.
I was geeking out on the weekend. I was at the beach with my family and they're like, what are you doing? And I'm like, I'm just doing some research. So yeah, I'm excited. I'm just about to start the anti-pigmentation end of things because I had very olive skin as a kid. Stupidly thought that because I didn't get red, right? So I have so often gotten so burnt. And I've got a lot of sun damage and that I just, anyway, that's all right. We start when we know better. So sunscreening it up. Dr. Ginni, I have taken enough of your time. Thank you so much for everything that you've shared with us. I just have absolutely loved hearing your passion and understanding just how flipping important this is to you. I would highly recommend everyone get the M word, How to Thrive in Menopause, because Dr. Ginni does go through so much more than what you could put in an hour interview. Do you want to just share a little bit about your new book? And then I will also include that in the order.
Yeah, so I just wrote one called Save Your Brain.
Yes.
And it deals with preventing Alzheimer's disease. There's a big section on menopause and the brain, the role of HRT in preventing dementia and where it works, and also talks about brain fog and managing brain fog, which 2/3 to 80% of women will get during perimenopause. So, and it contributes to the confidence cliff. There's heaps funny things, unexpected things. The result of all of the research that I did, which was 700 studies, 22 international experts, was I'm going to take up Tai Chi.
When do you sleep?
I'm going to take up Tai Chi and not doing any of those brain games. They're a waste of time, and I'm not taking any supplements.
Yep. Amen. Thank you. I know what I'm going to be. Oh, no, I've already ordered that. I pre-ordered. It should be here very soon. I'm so addicted to book buying at the moment. Every day there's an Amazon delivery person. And I'm like, okay. Anyway. Thank you so much. You have been an absolute gem. Thank you for your generosity of sharing your space on a Saturday morning, and go and enjoy your day. See you later. Bye-bye.
Thanks so much for tuning into another episode, and I trust you're walking away with inspiration, maybe some chiropractic adjustments of the soul where you've realized perhaps some ways that you're getting in your own way, or something that needs to be healed, or something that's calling to you that your heart really, really wants to birth or create or step into in this second cycle of life. And if that's you, I am throwing my arms wide open and inviting you to check out all of the ways that we could potentially partner together at kyliepatchett.com.au. That's my website for the podcast, and also one-on-one and group programs in midlife mentorship, yoga and breath work in specifically designed menopause classes online, and also super excitingly, a list of retreats around Australia that I have been blessed to partner with some pretty darn spectacular humans who also help midlife mavens through this transition point. So if you are looking for some support, some community, some tools, just a safe place to actually reconnect to who you are, what you want, and come home to your own power and magnificence, I would love to welcome you into any one of those containers. So head on over to kyliepatchett.com.au, and I will be back in your ears very, very soon.